Before the break, WFMY News 2's Tracy McCain told us about a task force designed to decrease diabetes rates here in the Triad. And now we're going to talk about a few of the things that people living with diabetes deal with and how to avoid some of those issues.
And joining us today is Dr. Claire Dillingham. She is the Chief of Plastic Surgery with Cone Health Medical Group Plastic Surgery. Thank you so much for joining us this evening.
Thank you.
First of all, when it comes to diabetes, you say feet are extremely important. Can you explain that a little bit more?
Certainly. So the feet are one of the parts of our body that gets the most wear and tear, and it helps keep us independent. And so if we lose that, or one or two of them, then we become more reliant on other people and oftentimes lose that independence that's so important to most people.
So what should people be looking out for?
So it's very important for everybody, but especially people with diabetes, to do daily foot checks. And so it's really important, if you can't see the bottom of your foot, maybe put a mirror on the floor and put your foot over the mirror so that you can see it. You could certainly have family members check as well. And proper fitting shoes, so important.
And what are you looking for when you're looking under the foot? Are you looking for a cut? What is it that you're looking for?
So sometimes when people who have diabetes develop it into the later stages, they lose the feeling.
Okay. And
And so they may not see something simple like a scab, a blister, and then those things can lead to more serious things. So certainly something that like a scar or a cut, but even something simple like a blister.
You're talking about some of those specifics. Do all of these, if some of these problems arise, do they all mean that you should go to see the doctor? And what are some of the treatment options?
Great question. So it is very important that people with diabetes see their physician on a daily, daily would be great, no, on a regular basis, whether it be every 6 months or every 12 months. When they take their coat off at the doctor's office, they should take their shoes off. Also, if you're a diabetic, you should see a podiatrist every 6 months. So looking for things like splits in your nails, cracks in your feet, really dry skin, malodor, something that smells, different than usual. And here at Cone, we are so blessed that we have really neat technology that is just the state of the art. And one of the things that we use for healing is A-cell, and that is regenerated cells from the bladder of a pig.
And you have an example.
And here's an example. So this is an actual sheet that we use with wound healing, and this is powder, and the powder is the same as the sheet, but sometimes it helps with healing. And this is actually incorporated and helps the body lay down the granulation tissue that helps with the healing process. It's really neat stuff.
Cutting edge stuff at Cone Health.
It is.
Alrighty, well, thank you so much for your insight. We appreciate you coming in here. Real quickly, any words of advice for someone who may be going through this?
Oh, not to get discouraged. Diet is very important, cutting back on your, blood sugars, but to see somebody quickly, to your question. Yes, if you have a problem, you should not wait. The sooner you get in to see medical advice about the issue, the better off you'll be. For limb salvage, it's really key.
So be aware as well. Dr. Dillingham, thank you so much for your time.
Thank you very much.
And if you have any more questions about diabetes, you can ask an expert yourself on Wednesday at 4 o'clock. Join a Cone Health expert for our live web chat on our website.
We also have links to more information on what you need to know on WFMYnews2.com.